I'm Lynn Teacher with Genomics, where our mission is to teach the integrative truths about the dynamics of the human body. Our goal is to make good therapists great. So I'm assuming the reason that you're watching this video is because you want to get great results with your clients and in your practice, and that's what we're all about. We want to take the tools that you already have and help to integrate them so that they can affect the body on all three levels. And we're also going to give you brand new tools to help take your practice and your results to completely new levels. We have a new class called Integrative Anatomy, and I wanted to give you a little quick preview of that and give you a tool that you can use on yourself right now and with your clients to not only get great results with this, but to integrate some of the work you're already doing. I noted that you're going to notice a big change. So the body has these points called reciprocals. They're kind of like little fuses that sometimes can get blown. And when they're not optimized, your body can't function properly on all levels. They are points that your body uses to maximize the proprioceptive nervous system, the myofascial system, as well as all of the informational pathways of the body, the Wei-Qi systems, the communication systems, and the acupuncture meridians. And I'm going to give you an example real quick that's going to harmonize all of those levels very quickly. So the reciprocal pair that I want to show you is the anterior hip joint and the opposite side anterior shoulder joint. This relationship between these two reciprocal joints is very important on all three levels of the body mind. On a structural level, the anterior hip joint is balanced with the anterior shoulder joint on the opposite side on a lot of different levels. But the one level I want to show you, which is simple and easy and quick, is the transverse abdominis and how it morphs into the pectoralis muscle across the body. Now, as your body structure holds up, if there's any tension or if that fascia is not optimized, it's going to pull you forward. This is a very common problem to have because we're all in flexion most of the time. We're sitting in cars. I know for me personally, I bend over clients a lot. We're sitting at desks, or we're in a constant state of fight or flight mode. What that's going to do is actually pull the connective tissue forward. Now, what that's going to do on a functional level is going to be pretty huge actually, because as we go through motion, this relationship of the anterior hip and shoulder, if it's not optimized, our body's not going to be able to go into a rotational transverse plane motion or frontal plane or even into extension, right? So we're stuck in flexion, we can't get open. Now this is important when you're walking. If this is shortened up, you're not going to be able to go through a full stride. And I've also seen this very relationship cause a lot of problems for, say, like baseball pitchers and quarterbacks in football, because they want to throw a ball and this relationship won't lengthen and optimize. It's going to tear up their rotator cuff and give them some hip problems. And then we have the emotional level. Body-centered psychology tells us that every part of the body represents something in the brain and the emotional levels and the belief systems. The hip represents stability and foundations and moving forward in life and support. The opposite anterior shoulder represents the burdens of life, the responsibilities of life, and even heart protection. So when we think about the relationship of having support and having burdens and responsibilities and moving forward in our life and being able to take on the responsibilities or having the support that we need to be responsible, it's a pretty deep psychological connection. And so as we optimize these reciprocals, we're affecting not only the mental and emotional levels, the functional levels, and the structural levels. Now that we know what this reciprocal is and what it does and how it affects the body, let's optimize it real quick. This is a very simple technique. You can do it on yourself right now. In fact, I encourage that because I want you to notice the effects that it has on your body. So I want you to take your right hand and place it on the left anterior aspect of your hip. Take your left hand and put it on the right anterior aspect of your shoulder, and be pretty specific to your hip joint right here in the front, inside your leg. What I want you to do is just kind of stimulate the area, just rub it a little bit to get the proprioceptors activated. And then I want you to breathe a connection. I want you to kind of optimize the relationship between these 2 points. So it's going to look just like this. In and out. We're just going to take 3 nice deep breaths. And that was it. That's all it took. Now I want you to notice once you did that, if you go into like a right rotation with your right hand now, you're going to notice that you've got a lot of motion right there. Now take that on the left, and I don't have nearly as much. You can see how quickly that worked. So let's go to the other side now that you see how restricted that is, and optimize that too so that you're balanced out. So let's take your left hand and place it on the anterior aspect of the right hip, and then take your right hand and place it on the left anterior shoulder. And now let's just stimulate and take 3 nice deep breaths. Okay, that was it. Now go into a little bit of left rotation and notice the difference and notice how you feel. Quite a bit of improvement, I'm sure. So what I want you to do now is also, now that you have both sides balanced, I want you to notice how that feels in your body. You should notice that it's a little bit easier for you to go into extension and stand upright. Perhaps even your heads come back a little bit, and you may have way more weight on your heels, as this gave your body the information it needs to harmonize on a lot of levels. You're even going to notice that you're a little bit more relaxed. When you go to work tomorrow, if you have a client that has some hip problems or shoulder problems, or maybe they're just stuck into chronic flexion, go ahead and try out this reciprocal on them and give it as a tool for them to take home to do some homework to really help themselves. And I want you to notice right after you do it, your client's going to notice that probably the pain's a little bit easier and the restriction is a lot better. So I want you to try that and see how that works for you. Okay, so now you see how powerful and effective that one reciprocal is. Imagine having 31 more reciprocals that you can use on yourself and with your clients every day. This tool is so great for helping with structural, functional, and energetic change, as well as pre and post workout. Your athletes that you work with will notice a huge difference in their athletic performance, where their whole body is optimized through these reciprocals before they perform. It's also going to give you a tool to give your clients that's going to help them overcome stubborn health issues. This class is going to incorporate structural, functional, and energetic information. So join us for Integrative Anatomy and start getting some great results.